Moving on to penicillins. We're all pretty familiar with penicillins. Most of us probably grew up at one point or another and had a prescription, unless we were allergic, for penicillin to treat an ear infection, to treat a respiratory infection. They are beta-lactam antibiotics. They are used to treat many streptococcal and some staphylococcal and meningococcal infections, usually respiratory or intestinal. It's the drug of choice for syphilis and is also used prophylactically to prevent recurrences of rheumatic fever. I'll give you a lot of different little information here, but to keep, for the purpose of brevity, I guess, I'm not going to go into all that little information. That's up to you to read. Side effects, usually hypersensitivity reactions, nausea, vomiting, diarrhea, renal and hepatic disorders, although they're rare. We want to use caution in anyone who has a history of allergy to penicillins or other beta-lactams, as well as treatment for severe reactions includes discontinuance of the drug, immediate administration of appropriate medications, blah, blah, blah. People can be pretty allergic to these medications, which is what they're getting at, so we always want to kind of keep that in the back of our minds. Interactions, you already know about probenecid. Probenecid can increase the, or can keep and increase the levels of penicillin within the body. Some food can sometimes interfere with penicillin absorption if it's given orally. And in addition, certain anti-inflammatory drugs such as methotrexate and salicylates can increase amoxicillin or penicillin effectiveness. Carbapenems, so that's your meropenem and your ertapenem. Those are IV medications. They're pretty broad spectrum against gram-negative and gram-positive organisms, including anaerobes and many multi-drug resistant organisms. They're used to treat pneumonia, febrile neutropenia, intra-abdominal infections, diabetic foot infections, and infections where there's multiple bacteria or bugs going on at once. They should be used cautiously in patients with documented penicillin allergies because, again, they're pretty similar and we just want to be careful. And when I say allergy, I'm not talking about the patient got nauseous or was vomiting. I'm talking about the patient had hives, anaphylaxis, difficulty breathing, swelling of the throat, neck, etc. So that's when we avoid those medications. Moving on to quinolones. You're also probably pretty familiar with these. Ciprofloxacin and levofloxacin are sort of the most common ones in that class, and they're used in urinary tract infections, sinus infections, lower respiratory tract, GI tract, skin, bone, joint infections, and gonorrhea. Again, a lot of different uses for these. Since these medications are used so often, there's a lot of resistance to them, unfortunately. These agents are usually reserved for infections that actually require therapy, so you're not going to find a doctor prescribing them for the common cold. He shouldn't be prescribing anything really, but sometimes they do, sort of just to get the patient out of their office and, you know, that sort of placebo effect of feeling better. Therefore, resistance. Side effects can include, of course, nausea, vomiting, diarrhea, superinfection, hypersensitivity. They can increase your sensitivity to light, which is pretty special to this class. They can also cause cartilage or tendon damage, and this came out a number of years ago that people were having their Achilles heel, or their Achilles tendon was snapping when they were on these medications. So always want to be careful with that. If somebody's complaining of tendon or joint pain, we definitely want to alert their doctor, possibly take them off the medication. Contraindications, older adults, especially with GI disease or arteriosclerosis, children or adolescents, pregnancy and lactating women, people with cardiac disease, or people with seizure disorders. And the cardiac disease is some of these medications can increase the risk of cardiac arrhythmias, so that's why we are careful with those patients. Interactions, warfarin, theophylline, probenecid, which increases blood levels of cipro. Antacids, we try to separate out administration, as well as sucralfate, which is another coating agent for the stomach, which is why that prevents the absorption of oral quinolones. Moving on to tetracyclines. These are broad-spectrum antibiotics used in the treatment of infection caused by rickettsia, chlamydia, and some uncommon bacteria. You also see them used in skin and structure infections such as acne, MRSA. It's also used in combination with other medications to treat H. pylori. Generally, we don't use them in children. That's under precautions. Can discolor their teeth. as well as cause other problems. We don't use it in pregnant or lactating women, patients with liver or GI disease or renal disease, and this class of medications can also increase sensitivity to some. Side effects include surprise, nausea, vomiting, diarrhea, as well as photosensitivity. So anybody who's going to be out in the sun needs to be a little more careful. Just again, we call it discolored teeth in fetus or young children, and it can, as I was saying, it can also basically retard bone growth in patients who are younger. So we try to avoid it if at all possible. Interactions. This interacts with antacids, calcium supplements, magnesium laxatives, iron salts, antidiarrheal agents, dairy products, and oral contraceptives. So if somebody's on tetracyclines, they usually are spaced out from other medications, strictly because we want the other medications to work as well as the tetracycline. So antifungals, I think I'm going to leave the rest of the chapter up to you guys. There's some pretty interesting reading. It is a long chapter, but hopefully you get the idea that this is going to be a chapter where you're doing a lot of rote memorization. There's not a lot of concepts here. It's just memorizing what drugs go in what class. So the green boxes always help. Those are different names of the medications, as well as remembering side effects, contraindications, and interactions. I will say that the tests usually do involve some of the little details that are under the paragraphs, so just pay attention to those and kind of make flashcards would be helpful for those interesting little details. Other than that, HIV is at the end under antiviral medications. A ton of information. This could be a chapter in and of itself. So there's some good information there as well, talking about treatment. If you guys have any questions, feel free to contact me. And you have till Saturday at 11 p.m. to do your drug project, part 3, as well as your MindTap homework for week 6 and your test, and also the week 6 forum. Have a great week, guys.